Welcome, everyone. Thanks for joining us. We're going to give it just one moment for people to join the line, and then we'll get started. Welcome and good morning or good afternoon to all of you. Thank you for joining us for the July National Farm to School Network Trending Topics webinar, Farm to Early Care and Education State Strategic Planning. My name is Lacey Stevens, and I'm a program manager with the National Farm to School Network, and I'll be your host and moderator for today's webinar. Just a few housekeeping reminders before we get started. This webinar will be recorded and archived for future viewing in the National Farm to School Network resource database. You'll also receive a link to access that recording, as well as resources and reports shared from our speakers today in a follow-up email in a few days. All of our listeners and attendees are in listen-only mode. We do encourage you to ask questions. As those questions come up, please enter those into the question box, and we'll have plenty of time for question and answer and dialogue with our panelists at the end of the session today. We have got a fantastic lineup of speakers today to discuss with us Farm to Early Care and Education State Strategic Planning, specifically that planning in the context of the Centers for Disease Control and Prevention's spectrum of opportunities for obesity prevention in early care and education settings. And we'll hear from our presenters how this approach supports comprehensive integration of farm to early care and education into existing systems and structures, which really increases reach and support and long-term success. So we'll start by hearing from Nora Geary from the Centers for Disease Control and Prevention, and then we'll hear from Erin Croom about the Georgia Farm to ECE Coalition and Strategic Plan, and then we'll turn to Caliste Chong from Alabama Partnership for Children, who will discuss Alabama's Farm to ECE Strategic Plan. So for those of you who may be joining us for the first time, I'd like to start by introducing you to the National Farm to School Network. We're an information, networking, and advocacy hub for communities that are working to bring local foods and food and agriculture education into schools and early care and education settings. And we are built on this network model that you see here with the national staff and advisory board, over 200 core and supporting partners in each state, DC, and several of the territories, and over 20,000 network members across the country. So that means that wherever you are, there are NFSN partners and likely network partners in your area to help support and advance farm to school and farm to early care and education. So to create some context for our discussion today, what are we talking about when we talk about farm to early care and education? And for us, farm to early care and education is not one defined program, but really this diverse group of strategies and activities that include at least one of what we call these core elements of access to healthy local foods through food procurement and local food procurement and purchasing, gardening opportunities, and food nutrition and agriculture education. And we'll hear from our presenters today about how these state strategies that they'll discuss can support comprehensive farm to early care and education, including all of these core elements together. And the benefits that we see when we see that comprehensive integration of farm to early care and education is what we like to call a triple win, with kids winning, farmers winning, and communities winning. And when we talk about bringing these core elements of farm to early care and education specifically into the early care and education settings and communities, we see additional compounding benefits that really parallel the goals of the early care and education environment. And as we'll see from our panelists today, create that alignment and opportunity for Farm to ECE to be a tool to meet these goals. And those goals include that meaningful family and community engagement, aligning with enhanced experiential education, supporting success in both program and learning standards, creating opportunities for lifelong health and wellness for children, families, and providers, and the opportunity to advance equity in education and food systems through farm to early care and education initiatives. So with that framing, I'd like to introduce you to our speakers who will be joining us to continue the farm to early care and education conversation. First, we'll hear from Nora Geary. She's a member of the early care and education team in the Division of Nutrition, Physical Activity, and Obesity at the Centers for Disease Control and Prevention. Nora provides guidance, support, and technical assistance to states and communities on systems-level approaches to ensure children get the healthiest start possible in early care and education settings. Next, we'll hear from Erin Croom. In 2007, Erin Croom joined Georgia Organics and established the state's first farm-to-school programming, which now reaches over 750,000 students. In 2016, she worked with partners to expand programming into the ECE setting and helped oversee a W.K. Kellogg Foundation project. She currently serves on the National Farm to School Network Advisory Board, and last year she founded Small Bites Adventure Club, a social impact business that ships farm-to-table cooking kits directly to schools so children can discover, love, and eat their fruits and vegetables. Caliste Chong is the Early Childhood Program Coordinator for the Alabama Partnership for Children. Since 2016, she's worked with APC, Nemours, and CDC to coordinate statewide efforts to embed obesity prevention strategies and best practices into existing early care and education systems. Through this work, training opportunities and technical assistance have been provided to ECE programs across the state focused on physical activity and nutrition topics. So I'm going to get us started by turning over to Nora.
Wonderful. Thank you, Lacey. Can you hear me okay?
We can, yes.
Okay, perfect. Good afternoon, everyone. My name is Nora Geary, and I'm with the Early Care and Education team with CDC's Division of Nutrition, Physical Activity, and Obesity. And I'll be talking with you about our framework for obesity prevention in early care and education settings, which we call the spectrum of opportunity, and how it can be used to support farm to ECE. Next slide. So as we all know, the ECE setting is a critical place that can directly influence what kids eat and drink and can have many ripple effects into the future. So at least 11 million children under the age of 6 spend time in childcare, and on average, they're spending around 30 hours a week in these settings. And more than 60% of 3 to 5-year-olds attend childcare weekly. The early care and education setting has an impact on supporting breastfeeding duration among working moms, directly influences what children eat and drink, their activity level, as well as the development of critical motor skills. In addition to being an important place for children's health, childcare programs are also shown to improve school readiness and early literacy. So these are really important places for us to be focusing our attention. Next slide. So here you see the CDC spectrum of opportunity, and we use this framework to guide most of our work. It serves as a framework for states and communities to help ECE facilities meet national obesity prevention standards. You can see here in the graphic the 9 avenues within a state ECE system where obesity prevention policies and practices, as well as support for those things, can be embedded to improve nutrition, physical activity, breastfeeding, and screen time policies, practices, and ECE environments. And as you look at the graphic, and as you think about your own work, you may see the spectrum area that your agency or organization falls within, or you may see the spectrum areas that you collaborate with, or perhaps areas that you're working to establish stronger relationships. We developed a new complementary document to the Spectrum of Opportunities framework, which we call our sub-options, and I'll show that to you in just a couple of slides. Next slide, please. The big picture, what are we trying to do? We're trying to implement and integrate national standards on nutrition, physical activity, breastfeeding, and screen time into statewide ECE systems, improve facility level policies, practices, and environments, and then implement best practices. Next slide, please. Thank you. So here is this complementary document that I talked about a little bit earlier, what we call our sub-options. And essentially, this document lists a variety of examples under each of the different spectrum avenues of how states and communities can work within the different spectrum areas. So if you're new to this work or seasoned veteran, this document really provides sort of specific examples of how you can work within these different systems. And it includes things like how standards can be added or strengthened within the spectrum areas. And then it also includes what we call system level support. So things that will ultimately help ECE providers implement standards. And I'll just note that the list that we came up with is really just a list. It's not all inclusive. And I'm sure there are many things that you're doing in your own states and communities that could be added to this. Next slide, please. So how can farm to ECE be embedded into the spectrum of opportunity? And then also, how can the spectrum of opportunity really support farm to ECE? Next slide. So for these next few slides, I'm going to walk through the spectrum of opportunity and give a few examples of strategies or actions that states and semi-state communities can consider to embed farm to ECE into their ECE systems, and then also how the spectrum can support farm to ECE activities. So I'll start with licensing. A few examples from working with your state licensing and administrative regulations could include recommending that ECE providers obtain training, continuing education, or certifications that include farm to ECE activities such as gardening, food exploration, taste testing, and cooking. Another example would be to incorporate farm to ECE content into required coursework, training, and education for ECE providers. And then a third example under licensing and administrative regulations, could be to require licensed centers to meet or participate in the child and adult care food program. CACFP is a natural dovetail with farm to ECE activities, and we know that programs who participate in CACFP serve better food and offer more fresh fruits and vegetables to children in their care. Which brings me right into the next spectrum area, the Child and Adult Care Food Program, which is its own system. And a couple of examples of how you could work within CACFP to promote farm to ECE might include promoting participation statewide, for programs to participate in or to comply with the CACFP meal patterns. Purchasing local, minimally processed foods can help providers meet CACFP meal patterns with diverse fruits and vegetables, whole grains, and lower sugar food options. In addition, incorporating seasonal and local products into meals when possible is listed as a best practice in CACFP. And then finally, through CACFP, there are sometimes trainings that are offered to participating programs. So one strategy could be to integrate farm to ECE nutrition, education activities into upcoming CACFP training for ECE programs. Next slide, please. Within the statewide access initiative, which includes farm to ECE, a few examples of actions or strategies could be to convene and connect farm to ECE programs in the state or farm to ECE organizations and bring everyone together to share best practices, lessons learned, to share resources that were developed, and perhaps ultimately to develop a statewide network to improve access to locally grown fresh produce. Facilitating central kitchen partnerships is one example, and this is a strategy that could increase access to healthy foods or fresh fruits and vegetables for many ECE programs. There are several opportunities to support farm to ECE within statewide recognition programs and intervention programs, such as including specific farm to ECE components or standards within a statewide recognition program or a statewide intervention. And then really thinking about how to cross-promote that recognition program or intervention program between multiple spectrum areas. So it could be promoted by the Child and Adult Care Food Program, technical assistance networks, or professional development training. So really lifting up and elevating those opportunities, which ultimately support providers. And then finally, ensuring that there are technical assistance resources available through statewide recognition programs or the intervention programs, again, to support implementation of farm to ECE activities. Next slide. So quality rating and improvement systems. So including specific farm to ECE activities as standards of higher quality care within QRIS. So for example, in Colorado, they assign quality points to any program that has a garden and serves fruits and vegetables from the garden for children to taste. So that's one example. A second strategy or action to support farm to ECE might be to ensure that quality rating and improvement coaches are trained on farm to ECE activities and can really support programs, connect those activities to achieving higher ratings within QRIS. For statewide technical assistance networks, really making sure that nutrition professionals or TA providers can provide assistance on menu planning, nutritional assessment of meals and snacks, again, to really support providers who are wanting to implement farm to ECE activities, helping them to reach their goals. As an add-on to that, hosting farm to ECE train-the-trainer sessions could target TA providers to help centers with cleaning, cooking, lessons, taste testing, and sourcing local foods. Next slide. So within pre-service and professional development, a couple of strategies or actions here, just briefly, is to make available, develop, and promote trainings that can be in person or online modules that cover farm to ECE topics. And then potentially even to think about working with pre-service training institutions or certification programs that train providers before they are actually, in the workforce, and to include and embed farm to ECE content into that curriculum. Within early learning standards, again, similar to QRIS, there's opportunities to embed or incorporate specific farm to ECE standards, and then also, sort of to build on that is, even if there aren't specific farm to ECE standards within the early learning standard document, a state or community could think about, okay, how could farm to ECE activities support these learning standards or meet these learning standards, sort of creating a crosswalk or a toolkit or a website just to help folks understand the possible connections between farm to ECE activities and early learning standards. Next slide, please. So within funding and finance, a few examples of strategies or actions that fall within this spectrum area would be, requiring programs that receive DCDF or Child Care Development Fund subsidies to participate in activities or receive training on farm to ECE, or thinking about working with a network of Head Start centers or pre-K in your state to incorporate farm to ECE activities into these settings. And again, it's strategies and actions that can scale up and reach many, many kids, right? So always great to start with one center, but to really then think about how can we lift that up and scale it to reach as many children as possible. Next slide. So these last two slides I'm going to go through somewhat quickly, but the point of them is really just to highlight how important cross-system linkages and collaborations are for widespread impact. And that was something Lacey talked about in her intro slide, right? Sort of this win-win-win. Because ultimately, what we want to see are the great things you're doing reach the most kids possible. So I'll just sort of go through these quickly. So linking QRIS to the Child and Adult Care Food Program, which, as I mentioned earlier, naturally dovetails with Farm to ECE activities, awarding quality points for programs that participate in CACFT, and then even seeing a cross promotion between these two systems. Next slide. So some states require programs that receive Child Care Development Fund subsidy dollars to participate in QRIS. So again, if you have that linkage and the QRIS system is already linked to participating in a Child Adult Care Food Program, then subsidy programs will naturally be linked to CACFP, right? So again, it's supporting these healthy nutrition, healthy practices. Next slide. And then the next step could be including specific standards that are related to Farm to ECE activities and attaching quality points to those, such as the example from Colorado that rewards programs for having a garden and doing taste tests from that garden. Next slide. So here we have, again, complementary standards within QRIS, and then also within a statewide recognition program or an intervention program. You have multiple different touch points for providers to be supported in implementing these types of activities. Next slide. And then for this one, really thinking about utilizing statewide technical assistance networks, training those providers in Farm to ECE activities so that they can really support ECE programs with implementation or planning to get Farm to ECE into the facilities. And the next slide. So that are all of my slides. So thank you so much. And then just a quick, announcement, I guess, that, at the CDC, the Early Care and Education team, we're always available if you have questions or need resources. We're available for technical assistance. So I've included our team email there. And we're always eager to support your systems level work or connect you with other folks that are working on strategies of interest. So thank you so much.
Thank you, Nora. That was such a wonderful view of how this framework can be used to create those really sustainable farm to early care and education initiatives, both at the state and community level. I particularly appreciate all that diversity of really tangible examples of places to start to build that web and support of integration across systems. So as you have questions for Nora, please feel free to enter those into the chat box, and we'll have time for questions and discussion at the end of the session. But for now, I'm going to go ahead and turn it over to Erin Croom to take this one step further into state strategic planning based on this network and framework. Erin, I'm turning it over to you, and we can't hear you.
Hi.
There you are.
Okay. Hi, thank you so much. My name is Erin Croom. I'm with Georgia Organics, and I've been chairing the Farm to ECE Coalition for a few years. And I'm going to talk to you a little bit about who our group is and how we got started and why we love the spectrum and what we're up to now. So we'll go to the next slide. So our goal, our official goal, is to have a network that joins stakeholders in early care, food, farming, nutrition, to coalesce resources and support Farm to ECE and create dialogue for building statewide programming. So that's a lot of words, and what we're really trying to say there is that we want a group that is from across our state that represents a lot of different types of organizations and fields, and that we know that the right hand basically knows what the left hand is doing around Farm to ECE. We want to create a community where people across disciplines and organizations and agencies and businesses, if they have a question or an idea, or they are struggling around an issue that relates to farm to school or farm to ECE, they have a face and a phone number that they can call and pick up the phone and work through something if they have an idea for a grant, or if somebody's calling them with a question about farm to ECE in any capacity, that they feel empowered, that they have relationships with people across many different types of organizations and agencies. So that is a beautiful thing. And I want to say that if you have a coalition that you're forming and that is the only thing that you've created, that is a huge opportunity for creating community and being able to create a foundation for something really great to work on. So that's first and foremost what our coalition is all about, is creating this community and network of people who are passionate about farm to ECE. We meet quarterly. We move our meetings around to different places. We meet in early care, we meet in state agencies, we meet in nonprofit offices, and we have field trips to lots of different places. And for those of you that are really interested in it, we use the cooperative operating system, which is a way to prepare agendas and share meeting notes and things like that on Google Slides. So we'll go to the next slide. Thanks. So this is what it looks like. We're really intentional to make sure that, obviously people come and go, but we have a really strong group of about 25 different organizations and businesses and agencies, and it's across discipline, as you can see. And anyway, we really try to make a very thoughtful stab at making sure that all of those different slots and disciplines are filled at any given moment, and that we're hearing from all of these agencies on a regular basis. So that looks a little overwhelming, lots of words, but we'll go to the next slide and you can see what we really look like. So there we are. It says on a field trip actually to the Children's Museum of Atlanta, where they have like a farm to table exhibit. So we're seeing, one of our partners that actually it has figured out how to incorporate farm to table and nutrition into, an exhibit that remains on the floor year round, and how they do outreach. So that's part of our group. And as you can see, we love each other. It's become, we are colleagues, but we are all, very good friends as well. So it's a really great group. Okay, so next slide. So in Georgia, we started, pretty slow with farm to ECE. 2007 is when our K-12 farm to school work, and I think it became pretty apparent early on that ECE was just a hard thing to just sort of tack on to K-12, because there's a whole different level of bureaucracies and systems that needed to be learned and thoughtfully discussed. And so we started working more intentionally with the Georgia Department of Early Care and Learning, which is the agency that oversees early care in Georgia. And as you can see, it's grown a lot, we I guess officially created our coalition sometime around 2015. So we'll go to the next slide. So I guess what we're trying to do today, from my understanding, is if you're thinking about doing farm to early care in your state, I guess my two big things are, one, make sure you have a great group of partners, and I recommend having a coalition group or a network or an alliance or whatever you call it, or you want to call it, with lots of different stakeholders that can bring different expertise. And the second one is, write a strategic plan. And while that is a very timely activity and, you know, can be one of the most boring tasks that you've ever done. It is so important, and it pays back in so many ways. And I think, you know, one of the most important things is, you know, putting something in writing and getting aligned on it on paper is so critical for so many different reasons, you know, for creating trust and partnerships. But secondly, I feel like in the farm to school world and in the nutrition world and in the nonprofit world in general, we often get into this really nasty cycle of chasing money, and instead of being very intentional about what we want to do, what we want to accomplish, and really sticking to our vision. And so writing that strategic plan really puts into place where you want to head. And then it allows you to seek the funding and the partnerships you need to achieve that vision and goals. And that certainly has helped us in Georgia on a number of fronts. So we'll go to the next slide. And I guess I would also say, when creating a strategic plan, making sure that you have a core group that has the expertise and a shared passion to help write that, and having, you know, alignment. And I have these organizations listed up here. And I've got, obviously, National Farm to School Network, because Lacey is so kind and generous with her time that she reads everything for us and makes sure that we're not forgetting things. So I think making sure that you have a great group to align with on the front end is important. So we'll go to the next slide. So why use the spectrum of opportunities for your strategic plan? I think, you know, one is it's so well laid out, and it's so beautiful, and that it helps obviously organize your thoughts around farm to ECE, and it helped organize our thoughts. But I think the second thing is that it just creates a really nice way for us to be respectful and thoughtful in our approach to creating change in the ECE world. I think one thing that I had to learn the hard way with ECE several years ago is just how much bureaucracy and hard work that providers have to think about every single day and have to work through every single day. And sometimes farm to ECE and nutrition is just not always at the forefront for a lot of different reasons. And so this really, you know, when you're using the spectrum of opportunities, you're kind of using the language and the systems that are impacting the day-to-day lives of ECE programmers and agencies that serve them. And I mean, I think, and thirdly, you know, it helps you keep your eye on the prize, which is how do you create system level change? And they've thought through these things really well. So even if you're doing a pilot program, but you're thinking about one of these pieces, like what can we learn about it from a statewide standpoint, I think it really helps you figure out how you're going to scale up and serve your entire state. So I guess my recommendation is if you're like me, and you know, we're not familiar with many of these different aspects of early care, you know, spending time with different people, you know, that are affected by these different pieces of the spectrum, either providers or going to the experts at the state level to have them tell you everything that they know about pre-service and professional development systems, or CACFP, or you know, licensing and administration. And really, you know, if they'll give it to you, you know, spending an hour or two really outlining and understanding, you know, asking questions and, you know, signing up for trainings that providers go through where they have to understand and learn. And that really, I guess, helped us figure out where the bigger leverage points were in Georgia, because there may not be, you know, farm to ECE experts, you know, in the state agencies, but there are experts in CACFP and licensing and all of those people, you know, quality rated, and those people are brilliant and they know these systems inside and out. And the more that you can understand it, the more you can see, oh, okay, well, this is how this would align with farm to ECE in some different ways, and help you figure out how to adjust your strategies and your work to make your work easier. And this, I mean, these are the programs, they're not going away. So it's really on us to kind of figure out how to align and support our programming around these systems. So next slide. So we tried to keep our plan very simple. So we were starting, you know, sort of from scratch. There were a few pilot programs here and there across the state. So these were our 4 main goals. And what we did is we had these sub-objectives that relate to the spectrum of opportunities under each one. And we tried to keep them as smart as possible. I think one thing I was going to mention is, well, we'll go to the next slide. So here you can see just some of the things that we focused on. The first picture is we focused on professional development, which, as we talked about earlier, is on the spectrum of opportunities. And so since we didn't have any funding per se, our coalition was full of really incredible, whoops. Am I still here?
Yep, we can hear you, Erin.
Oh, weird. Okay. Okay. I can't see you, but I'm going to keep talking. So our Speakers Bureau was, we created a group of speakers where we got 10 people. We have dietitians, we have chefs, we have public health and state agencies. And so we go around to the state to existing state conferences that offer professional development credits, and we make sure that there is a farm to ECE session or 2 or 3 at each of those. So in addition, we have, you know, standalone farm to ECE workshops, but that was one way that we could help dramatically increase the number of professional development opportunities that that providers had around the state. The second one was we have a crosswalk, which we basically took the North Carolina crosswalk that looked at the ECRS 3 and translated it to Georgia, and that's something that our state agency was able to take on, and that was a nice lift and has been an incredibly helpful tool in helping us kind of advance our conversations around how farm to ECE fits into quality rated here in Georgia. And then, you know, with the incentives, you know, piloting out pop-up markets, and that's Little Ones Learning Center, and learning how that can increase consumptions of fruits and vegetables and family engagement. And then the other one I wanted to mention is a statewide incentive program. So folding in and farm to ECE into an existing statewide incentive program that we had for K-12 for farm to school was really critical. And then we'll do next slide. And I just wanted to show you this. I would love to hear if people have other great ideas about how to track achievements. And this is one way that we do it. It's just a nice little snapshot that we try to do every quarter so people can kind of see where we're at and how far along and if we're really missing the boat on something. And so different groups can kind of contribute and help us get to where we need to go. And next slide. So yeah, it's our strategic plan comes to an end in 2020, so we'll be revising that. In the next slide, the spectrum of opportunities was updated while we are in the last year, so we'll be using the new spectrum of opportunities to guide our new strategic plan. And then lastly, I think one of the things that the group has been working on is finding ways to more intentionally integrate racial equity and how we're going to measure that through this strategic plan in the next year. And we're looking for new ways to incorporate that. And this is a framework that was brought to my attention that seems like it might be a great fit for our group. So I'll wrap it up there. And as you can see, we love the spectrum of opportunities and would strongly recommend everyone using it for your statewide strategy. Thanks, Lacey.
Great. Thank you so much, Erin. It's always wonderful to hear the great work happening in Georgia. They really have been leaders in this field, and Erin and her team are so generous in sharing their learnings and knowledge and resources. So thank you for being here, Erin, to do that. And I think something that Erin's presentation really highlighted is that the continually evolving nature of farm to early care and education, and that, they developed their strategic plan and had a path, but acknowledged that there are next steps happening with that strategic plan, and there's always more places to go and more partners to work with. So thank you, Erin, for being here to share that work. I'm going to as you have questions for Erin, please enter those in the chat box, and we'll address some of those at the end as we have time. But I'd like to turn it over to Caliste, Chong, to share their work in Alabama.
Thank you, Lacey. I really appreciate this opportunity, and I'm going to jump right in to make sure that we have time for questions later. But I just wanted to say thanks to Lacey for the opportunity to share about this work in Alabama. That is a budding, developing work in progress. I also want to say that I appreciate these opportunities to hear from and learn from other states about the work that they do and the process they've walked through. And Georgia, of course, is much farther along in their process than we are. And so today I'm going to mostly discuss our process to develop our strategic plan and then where we are a little bit with implementation. And so, like Lacey said, I'm Caliste Chong, and I work with Alabama Partnership for Children. And the APC is a statewide nonprofit whose vision is to really ensure that all young children, in particular birth to 5, have everything they need to grow up healthy and ready to succeed. And that really is a huge task and a huge goal, but we do our very best to bring resources and find programming to meet the needs of our young children in our state and their families. And so several years ago, we began to learn more about obesity and how nutrition and physical activity are huge factors, of course, in early childhood health. And we realized that these things weren't intentionally being addressed in our ECE systems. Next slide, please. So we began to seek out different funding opportunities and different ways to be able to implement this type of work. So in around 2015, 2016, we submitted an application to Nemours to begin our journey into this obesity prevention in the early care and education setting work. And as we go along, I want to mention that I can't take all the credit for writing our strategic plan for Farm to ECE. Child Care Aware of America was really instrumental throughout this entire process of supporting and guiding, leading the development of our plan, and they really provided a capacity to us to develop this awesome tool that was done much more quickly than we could have ever done just by ourselves. But just to go back to the Nemours work, we really started out at the two-prong approach, and we began working with Child Care Aware of America and Nemours at around the same time. So we began with Nemours with a two-prong approach where we looked at the spectrum of opportunities and all of the different things that the spectrum holds, and really began to think about systemic change and then programmatic support. So if we're making changes at the state level, what type of supports and resources can we provide to ECE programs to help them then make those changes? So we simultaneously began implementing a learning collaborative model with childcare providers, teaching them about all these different types of obesity prevention topics. And we also launched an early childhood obesity prevention stakeholder group at the same time. at the state and local level to really get folks together to determine what opportunities are possible and feasible for our state at this time. And then we also applied, like I said, to Child Care Aware of America for the Healthy Child Care, Healthy Communities project. And the round one of that project really focused on a broad range of topics, but as we went along with our discussions, we really identified Farm to ECE as a potential area to really make some impact in our state. And so we ended that year's project by having developed just the beginning of our coalition, our budding coalition. And then Child Care Aware also provided some support to create some maps for Alabama to try to connect our child care providers with farmers markets and roadside markets and things like that. And then as we closed out that program, we began to realize that we needed some more support and some help, further assistance to organize and strategize within our coalition. So then we applied for round two. And our focus for round two of Healthy Child Care, Healthy Communities was really the writing of our strategic plan. And we felt that we really wanted a strategic plan because it would give our group a coordinated direction of where there are so many different potential opportunities. What are the real opportunities that we feel we can accomplish over the next 3 years? And so we wanted to look at, through this process, what we wanted to gain a better understanding from our providers, what their needs, their concerns, what their interests are. We also wanted to look to our farmers just to hear about what they're interested in, what their interests are, their abilities, their limitations. We learned that there are quite a few challenges that we have to overcome. And then also we felt like we needed a real coordinated set of guiding principles and core values for our coalition as we began to move forward. Next slide, please. And so we began by identifying other entities that might have an interest in this type of work. And over the course of around 6 months, our initial team was developed. And so we began sort of similarly to Erin in looking at who we saw in the beginning as our most critical partners. And we definitely know that we have a long list of prospective partners, and this will not be our end result of our coalition list, but this is where we have begun. So we began with looking at our state agencies with our Department of Education, which houses CACFP. We began to work with our Department of Public Health, and then also with our Department of Agriculture and Industries, which houses our Alabama Farm to School program. We also began looking at other nonprofits that were doing similar work and had a similar vision, such as Rev Birmingham in Alabama, and also a couple of other huge partners that we really wanted to engage that had relationship with farmers was our Farm Food Collaborative, and as well as, you know, different food banks across the state. And then we also wanted to engage partners that had that communication with childcare providers as well. So we've engaged several childcare resource and referral agencies. So we just wanted to bring all these partners together that really don't intersect in any other way to try to figure out how we can partner and how we can really work together to make this possible for Alabama. Next slide, please. And so our process sort of looked like this. We really feel like community input is so important to the development of our strategic plan. And so we spent several months seeking feedback from providers and farmers, food hubs, and other stakeholders, just to get an idea of what the needs and the challenges are, what would make it feasible and possible for this to grow in Alabama. And then we worked together to develop our strategic plan, taking in consideration all of these things. So we had 2 parts of our program where we really gathered input from our partners and then also from providers and farmers. So we had focus groups. We had 4 focus groups last summer where we had some focus groups of just providers and some focus groups of a combined group of providers and farmers. And we just asked them a lot of questions just to try to figure out what are their interests, what do they feel is feasible, what can we do to make this work? And we gained some really incredible information from those focus groups. We also developed the needs assessment that we sent out to ECE providers, and we provided that as an online survey and also as a paper survey. And then we used all of this information and feedback that we received, as well as some internal coalition surveys to develop our strategic plan. Next slide, please. And so here are some of the findings from our surveys and our focus groups. I won't read all of these, of course, but I just wanted to mention the second bullet there around farm to ECE can promote cross-generational habits and memories. Many of the providers and the farmers that we spoke with, they talked about how they had such fond memories of farming, gardening, and even just helping their grandparents or their parents in the garden or with flowers and things like that. And they had such fond memories. And so they all really had this idea that they want to pass that on to the next generation, to pass that on to the children in their care. And so that became really a topic of discussion that was very strong for many of the providers, as well as myself, with memories that I have growing up with my grandparents that I want to pass on to my own children. So we felt like that was a really strong point for being able to push this work forward, to be able to pass that on to our children and the next generation. And these are not really things that our next generation are beginning to, what we're beginning to lose it, I feel like, to be real honest. And then also, of course, we identified quite a few needs and quite a few challenges, and these are all things that were very expected. And so we decided that with the writing of our strategic plan that we wanted to work to address these types of issues in our action steps in our strategic plan. Next slide, please. And so with our strategic plan, these are the different aspects or components of our plan. So we have a Farm to ECE coalition background, and we have a vision, which is listed at the bottom there. We have a mission that focuses a lot on health and equity and creating new markets and community-informed solutions and building local and statewide capacity and infrastructure for this type of work and building these types of connections. And on the left side there, that is kind of an example of what we did to have a survey for our coalition members. So we had all of these different topics, and we asked all of the coalition members to rank our highest priorities within each strategic objective. And that's how we determined what our actual objectives that we will work on over the next 3 years would be. And then we also, in the same way, developed our core values. And these core values really focus on collaboration, which that's the whole point of our coalition, is collaboration and bringing the partners in to work with us on this. Community voice, making sure that we not only are a voice for those in our communities that we're working with, but making sure that they have a place at the table as well to have a voice. A strengths-based approach, as well as equity. We want to ensure that we focus on equity in everything that we do, and not just focus on equity, but to ensure that equity is overarching focus for that's intertwined in everything that we do. It's not just something that's listed in a list. It's something that is really intertwined in everything that we do. And then also something that is really important to our group was openness, accountability, and clear communication with one another and with the folks that we're working with, our providers and our farmers. Next slide, please. So here are our strategic objectives that we had decided on. And within each one, I feel that we are addressing some of the spectrum of opportunities. And I've listed the 5 spectrum of opportunities that I feel like we are addressing specifically on the sides there. Of course, the statewide access initiatives, that's what this project is all about. And then pre-service and professional development systems, we're really utilizing the learning collaborative model and partners to incorporate farm to ECE in existing trainings. And then with ECE funding streams, we've been able to secure funding through the Child Care Development Fund for our obesity prevention in general. But then we've also begun to include farm to ECE information and training within our learning collaborative model that's funded by the CCDF funding. And then CACFP, we have in our coalition a representative from CACFP in Alabama that is over the farm to preschool program. And so we're working to see what we can do to increase participation in that program within CACFP. And then with the statewide technical assistance networks, we work with existing quality enhancement organizations that already know the providers in their areas, the regional organizations that provide trainings and resources to those providers. And we work with them to provide them with different training materials and things like that. And also we work with them to lead our learning collaboratives as well. And then, like Erin mentioned also, under our strategic objectives, we also have action items that we really look towards to develop our action plans for the year. Next slide, please. And so I feel like we've had quite a few successes already, although we just finalized our plan in January of this year. I just wanted to mention a couple. One is that we've been able to, through the Farm Food Collaborative in North Alabama, they have sought out funding from local foundations to be able to pilot a local procurement project with ECE programs in the Huntsville area. And so over the last 2 years, as we've begun having these conversations, different partners have sought out funding for these types of programs to see what it is that they can do to contribute to this process and to keep, our work moving forward. Also, I've been able to intentionally write into my funding opportunities, Farm to ECE action steps to help increase my capacity in particular to focus on moving this work forward as the primary facilitator and convener of our group. We've also, through our learning collaboratives, been able to incorporate Farm to ECE trainings into existing trainings that we have going on. We've worked very hard to facilitate Farm to ECE program and farmer relationships, as well as we had some meet and greet activities, events earlier this year, and school programs as well as ECE programs were included in that. And then looking towards our next steps, we have a lot of next steps because we're just beginning, and this is only just scratching the surface with what I've listed there. But there's 2 main opportunities that we're really working on right now, and that is the Association of State Public Health Nutritionists. We have been asked to participate in their Farm to ECE mini coin project. And so we are in the midst of developing training materials and implementing a learning collaborative focused on Farm to ECE. And then one that is not mentioned up there is just working on equity and diversity and ensuring that our Farm to ECE work really is focusing on equity and diversity, and that it's not just a topic, but it's really embedded into the work that we're doing. And we have a training scheduled this August for all of our Farm to ECE partners. So we are really excited about this work, and we love the work that we're doing, and so grateful for having this opportunity to share with you today. So thank you.
Thank you so much, Caliste. It's really fantastic to see that process and really appreciate you sharing how that process worked in your state. I think that's really influential for a lot of folks as they're gearing up for this work. We don't have a lot of time left, and we have a lot of really great questions. So for those of you whose questions we don't get to, I will connect those questions to our panelists, or I'll respond to you following up. Really appreciate all the dialogue, and we'll make sure that we can follow up with you following the webinar individually. There is one question that I think it would be really valuable to actually hear from all of our panelists, because I think it's a pretty big, salient question that would love to get your perspectives on, and I think it'll be a great way to kind of wrap up our webinar today. So the question is around, as a state level folks, or folks who are looking to advance this work at their state, are having conversations with early care and education experts and leaders within those different realms that we talked about. A lot of times they have a lot of competing priorities, or bigger fish to fry, as this person puts it. Living wages for early care and education providers, basic access to early care and education. And so there might be interest, but how do we help those leaders prioritize farm to early care and education and make sure that it's a priority in the work they're doing? So I'd love to get some thoughts from each of our panelists as we close out on that question about how do we make sure that these ECE experts and leaders can help prioritize farm to early care and education with all those competing priorities. And let's just move backwards. Caliste, maybe you can get us started.
Yeah, sure. Working at the state level, I definitely feel this pressure within, especially working with our state agency partners. But one huge opportunity that we have found is that we've been able to incorporate Farm to ECE into existing work through our learning collaboratives, through funding that we're already receiving, just to begin to get us started. I know that there's so much pressure with CCDF, with our quality rating and improvement systems, with the preschool development grants. There's so many different things. There seems to be so many different opportunities as well. But I feel like we try to frame our work in a way that shows that these types of topics, they are really integral to the health and the development, the holistic look and vision of what we need to do for young children to make sure that they grow up healthy, to make sure that all their basic needs are met. And I feel like really even considering farm to ECE is a basic need. They need to know where their food comes from, not that a carrot comes from the grocery store, but that it's actually grown in the ground. They need to see that and get back to the root of those things. But I feel like that's one way that we've been able to do it. I really like the way that Erin had mentioned the report that they had developed, the crosswalk between the QRIS standards and farm to ECE. I feel like that was really great, and that's something that I want to take back to, my state and to do as well, to make sure that we are helping our state agencies and our other partners to see how farm to ECE fits within the different realms, within the different factors of the work that we're doing.
Great. Thank you, Caliste. Erin, how about you? Anything to add to that?
Sure. I would just say every early care provider is different, and every challenge that they're facing is different. And if you're working on a one-to-one basis, finding out what their challenge is and how farm to ECE might work. So if an early care center is struggling with family engagement, there are so many great ways to figure out ways to engage families around taking field trips to farms or having special events where kids are, teaching their parents how to prepare simple things or, cutting things from the garden. I think working from where they're interested and focusing on improving is like the first step, instead of trying to shove in nutrition education or farm to ECE where there isn't a natural fit from that angle. And I think the second thing is one of the most, and I talked about the Speakers Bureau before, but having those conferences where early care providers are attending and for them to see and hear people who are doing farm to school. So if you're investing in pilot programs, make sure you're investing in getting those people that are leading pilot programs to be statewide speakers on panels, record them on videos. People want to hear from people in their position that are addressing the same challenges that they're addressing every day, that are doing farm to school, and why they're making the effort to do it. And I think that's a much more compelling way to approach it than, having a nonprofit representative stand up and say it's important.
That's great. Thank you, Erin. Nora, any final words about how we are able to support prioritization of farm to ECE?
Yeah, and I'll be very brief. I think three things come to the top of my mind. So really framing farm to ECE, not as like another thing that folks have to do, but really searching for the natural alignment of farm to ECE with things that providers are already doing or are already being asked of providers. So really finding that natural alignment. And then I think also really thinking about, connecting healthy nutrition to children's growth and development and cognitive development. I mean, that resonates with parents, that resonates with teachers, providers. And then also thinking about how farm to ECE activities is good for business, right? It's good for an ECE business, right? If it's an independent entity, how these types of activities are good for their program. And then finally, we've seen this with physical activity a lot, but those type of trainings on physical activity are really seen as providers as like a carrot, right? This is something that is for us, right? It's not just another thing to do. So I think really thinking about how to frame farm to ECE in that same way is another thing to consider.
Thank you, Nora. I think that really underscores the cross-sector benefits that we talked about and how we have this opportunity to frame based on what those target stakeholders are interested in. So thank you all for being patient and sticking with us. As I said, we'll aim to follow up with those questions. Either I or myself, our panelists will follow up. I do want to invite you to our next Trending Topics webinar, August 1st, which is looking at state-local purchasing incentives, which I know many of you might be interested as we think about work at this state level. And also remind you to save the dates for the next National Farm to Cafeteria Conference in Albuquerque next April. And before that, you can gear up for National Farm to School Month coming in October. So thank you all for your time. Again, you'll receive an email with many of the resources that our presenters mentioned, as well as a recording of this webinar, and we'll be in touch following up on questions. Have a great day. Thank you all.